which is Dr. Sandhya Kumar. Dr. Kumar is an expert in headache medicine and sleep medicine. She is an associate professor in the Department of Neurology, as well as the program director of Sleep Medicine Fellowship at Wake Forest Baptist Health in North Carolina. She received her medical degree in India, followed by internship and neurology residency at Wake Forest School of Medicine, where she also completed her sleep medicine fellowship. She is board certified in neurology, headache medicine, as well as sleep medicine. She has been in the list of best doctors in America since 2015. She has published articles on both headaches and sleep, been interviewed by local TV stations, has been quoted in Time Magazine, Huffington Post, and has presented to both regional and national audiences. I would like to welcome Dr. Kumar.
Hey, thank you all. Let me share the screen. Can you see it now?
Yes, looks great.
Okay, great. Well, thank you all for having me. We had great talks from Dr. Strauss and Dr. Wells. And thank you for you all to having have invited us and to be here and for all the work that you do for migraine. Can you hear me okay? Okay. So again, my talk is on sleep and headache. And as stated before by Katie, you know, those are two specialties within neurology that's of great interest to me. And so without much ado, let me go ahead into the talk. So this is a slide that I really like, you know, like if sleep doesn't serve an absolutely vital function, it is the biggest mistake evolution ever made, you know. So when you think about sleep, you know, you spend about 1/3 of your life in sleep, right? At least you have to get about 7 to 8 hours of sleep. So you spend 1/3 of your life in sleep, and there has to be something, you know, with sleep for our health. And let's look into that. So coming to sleep and headaches, you know, the relationship between sleep and headaches were known for centuries. And even back in the 1800s, in 1853, Romberg wrote, the attack is generally closed by a profound and refreshing sleep. And all of us who do have migraine headaches, including me, I'm a migraine sufferer too, know that, you know, once you have a migraine, if you're able to get a good sleep, and your headaches do much better. And similarly, again in 1873, Liebing marked that for an acute attack of migraine, the most frequent termination by far is sleep. And again, you know, that's something that most of our migrainists know. So there is certainly a relationship. It's complex, not entirely understood, but we can say at least we know something regarding that, and let's look into that. So two of the most common disorders that is seen in the clinical practice are, you know, migraine in neurology, and if you look at sleep apnea, it's widely prevalent, though, you know, still there is underestimation of the sleep apnea as well as migraine in our society. So if you look at sleep apnea, about 10 to 17% of males and about 3 to 9% of females have sleep apnea, which is one of the common sleep disorders known. And when you look at migraine, about 13% in an overall population have migraine. Certainly it's much more higher in females. As you see there, about 17.5%. When compared to males, it's about 8.8%. And if you look at sleep disorders in that population of people who have headaches, they are about 2 to 8 times more common if you have headache of some sort. And so let's look at the relationship again. So headache is the symptom of a primary sleep disturbance, which means if you have anything that causes difficulty in your sleep, you know, like it could be pain, it could be depression, could be anxiety, and that is could result in a headache. And if you have a primary headache disorder, like migraine headaches, cluster headaches, those can certainly affect your sleep. So it could be bidirectional, as you see. And sleep disturbance and headache are symptoms of an unrelated medical disorder. We'll look into that. And both of them have certain commonalities when you look at the pathology behind that. So let's look at that a little bit more. So as I said, if you have the following, anything that disturbs sleep, as I said, you could have sleep apnea, you could have what we call restless leg, which is something which, you have the urge to move the legs, which happens mostly in the night times, which really have difficulty for you to fall asleep. And clearly, if you have any difficulty maintaining sleep or falling asleep, or if you have pain, anything to do with depression, anxiety, or for simple reasons like, you do not have a good pillow, or you have some, arthritis in your neck and your neck is not positioned properly, that can add on to the problem with sleep disturbance and headache. So I know this is, I just put the slide there just to see how closely the pathology between sleep and headache resides in the brain. Okay, I'm not going to go through the whole process about it, but just few clarifications. So this is the about sleep. So if you look at it, light really plays an important role in our wake and sleep rhythm. Okay, so what I'm trying to show here is, the light from here, the light goes to an area in our brain called the thalamus and hypothalamus. These are the areas which are crucial in sleep and awake. Okay, and from there they do go through other parts of the brain. So that's about sleep, pathology. When you look at migraine, all of us know that migraine, sensitivity to light is a key factor. And when you look at the pathology behind that, again, light from your eyes, it goes again to the area of thalamus and hypothalamus area, which is, as you see, which is very closely related to our sleep cycle. And then from there, it goes to these two areas. This area is where you perceive the pain when you have the migraine headache. That's the area of the brain where you perceive the pain. And this is the area of the brain which is important for your vision. And so when you have the visual auras, when you have the flashing lights, when you have the sensitivity, these are the two areas of the brain which comes in. And as you see how closely those pathology between sleep and headache are related in the brain. So there is clearly an underlying shared pathology between sleep and headache in general. And so let me go through a few studies which looked at sleep and headache. And so this was like a study where they were looking at about 1,400 patients with headaches, and 1,200 of them have migraines. And they were looking to see what is the pattern and what is the complaint from this population in regards to sleep. So about more than half of them said that their migraines caused them to have some sort of sleep disturbance, which I think we all can come to terms with, and we all know about it. And about a three-quarters of them, almost three-quarters of them said, at least at some time, headaches have awakened them from sleep. And most of them, or nearly half between 4 o'clock in the morning and 9 o'clock in the morning. And let's pause a little bit and look into that. So most of I think, like when you have headaches, like most of the time when you have people do have weekend headache, and when you think about it, you have a routine during the week, where you get up in the morning, say at 6 o'clock, have your caffeine at 6 o'clock, coffee, tea, or whatever, and that's your routine. But then the weekend, you try to sleep in a little bit later, and then you tend to get up at 9 o'clock, and boom, you wake up with a headache, because that's sort of a little withdrawal from the caffeine too, so that can add on to it. And if you look at difficulty falling asleep or maintaining sleep, there is a threefold increase in sleep difficulties when compared to the general population. As well as, like there are people who do have migraines in general have shorter sleep periods, which we describe as less than 6 hours in about 38% of individuals. So normal sleep, we think about normal sleep as between 7 to 8 hours. That's the normal requirement of sleep for us in general. But most of the migraineurs, or not most, at least 38% of them have shorter sleep periods. So sleep, if you sleep too little or too long, both the extremes are really not good for migraineurs in general. Interestingly, sleep also do benefit headaches, as we all know. With migraines, we choose to sleep or rest due to headaches about 85%, and then they are forced to sleep or take rest, due to headaches in 75% of the individuals. So it goes both ways. So this is a little, diagram to show about, as I said, like this is short sleep, this is long sleep, this is the normal duration of sleep. So both, if you have a shorter sleep duration or a longer sleep duration, they have headache frequency more than when compared to the people who have normal sleep duration. Similarly, if you look at severe headache days, certainly shorter sleep and longer sleep have more severe headache days when compared to people who have shorter sleep. And you can argue that it's basically because you have a headache that you either sleep long because you have a headache, you want to sleep, or you have a headache and you really cannot get that good sleep. You can argue that way. And if you look at headache-free days, certainly if you look at a normal sleep, people have a much higher headache-free days than compared to shorter or longer sleep pattern. And so this is a little table that I put it in here. So in the sleep world, the way we can at least see how sleepy you are during the daytime is by something called the Epworth Sleepiness Score. That's something that you have. There are 8 instances, and we give them the questionnaire and ask them how sleepy they are during these instances. And you get a score anywhere from 0 to 24. And less than 10 is within normal limits. So the mean score usually is like about 8.4. And that study was just within normal limits. But when you look at a score of 10 or higher, which is supposed to be abnormal, in other words, more sleepy, 37% of migraineurs have a score of 10 or higher. And episodic migraine, which is if you have migraine headaches less than 15 days a month, they are 32%. And if you have chronic migraine, which is headache 15 days or more in a month, they are about 40%. So people who do have chronic migraine have a much higher percentage of being sleepy. And if you look at this here, this is a score of 15 or more. Chronic migraineurs, 15% of chronic migraineurs seem to be a little sleepy or fatigued during the daytime. And I don't want to go through this whole thing. I just put it there to just tell you a few things about chronic migraineurs and how they perceive, and the relationship with sleep again. So this was a very large study taking about 1,200 individuals, and 1,100 of them had episodic migraine. About 11,000 had episodic migraine, 1,100 about chronic migraine. And they were looking at what is the quality of your sleep, as well as if you have risk factor for sleep apnea. And what that study showed was, patients who had a chronic migraine were at much higher risk for sleep apnea, and were at much higher risk for having a poor sleep quality than when compared to with episodic migraine. Okay, so it's clearly shown that people who do have chronic migraines have a much higher risk of not only poor sleep quality, they are probably at higher risk for sleep disorders like sleep apnea. Now, a little bit about childhood migraine and sleep. Yes, there is a very close relationship even in childhood migraine. And this was a study done, what they were looking at, they were looking at children who came to a headache center for 10 years between 2007 and 2017, and who were diagnosed with migraines, as well as who had a sleep study within 1 year of the diagnosis of migraines. And the controls were children who did not have the sleep study. So here, it's against medical terms, but what I'm trying to explain here is N3 is where is the deeper stages of sleep and the real consolidated deep sleep. That is found to be much lower. And this sleep is in the lighter stages of sleep, N2. So when the deep sleep is lower, naturally the lighter sleep is higher. So they found out that your sleep quality is clearly deranged even in childhood migraines, not only in adults. And then they looked at what are the common causes for referral to the sleep clinic in these children. And if you look at it, snoring or pauses in the breathing, where about 2/3 of the children who were referred from the headache clinic to the sleep clinic this stopped. They either were snoring or were having pauses in their breathing, and then they had either difficulty falling asleep or maintaining sleep or excessive daytime sleepiness. These three topped. And so when they did the sleep study, and what did the sleep study show? 40% of the children who were referred to the sleep clinic had sleep apnea. That is quite a high percentage of children if you look at it, right? And then 27 of them had insomnia, which is a difficulty. And then the third one was snoring. Again, there you see a common theme where, difficulty initiating sleep, maintaining sleep, sleep apnea really goes hand in hand with migraine. So this is something, how headache and sleep are clearly intertwined, and how episodic migraine, you have few headaches a month, how does that turn into chronic migraine, and how does sleep play a role in it? So let's look at it a little bit. So here from the beginning, you have the headache onset. And so what do? When you have headache, we try to we have coping behaviors to help with the headache, which could include medication overuse. You take, and especially as Dr. Wells and Dr. Strauss had told before, the key to treating a migraine is to take the rescue medication as soon as we can. And unfortunately, some of us won't be able to do that. So what happens is the first medication doesn't help much. So we go take the second time, that might not be helpful. We keep taking more medications, and then we get into medication overuse. And as you see, a lot of medications available over the counter has caffeine in them. That is not good for sleep or for headaches in general, because we have known that if taking caffeine after like 3 o'clock in the evening can derange your sleep quality. Most of them would say, no, I can take coffee at 10 o'clock and go to sleep. You probably will be able to sleep, but it's the quality of your sleep is deranged a lot, okay? So, and then obviously when you have severe migraine, we sleep, we take naps. And that certainly does not help with your sleep at night, and certainly caffeine use. So what these three does is, that causes a variability in your sleep-wake pattern, right? You cannot, you sleep during the day, your nighttime sleep is, you can get good sleep because you can fall asleep at the reasonable time at night. And so that just results in chronic insomnia. If you have sort of frequent headaches, you keep doing all these, there is your night-day cycle is changed, and that leads to chronic insomnia. And then that leads to changes in your circadian rhythm, which is again the shift in the night-wake cycle. And that also causes decrease in slow wave activities, your really deep sleep. There is a reduction in your deep sleep. And that clearly results in a distribution in your sleep physiology in general. And so that leads to more headaches because you're not sleeping. Your sleep is all over the place. You're not getting a good sleep. And so you see that how the cycle goes on and on in a loop. And so starting from like episodic migraine, this turns into chronic migraine. So that's what happens. So when you look at, like a chronic migraine or chronic headaches, 3 to 5% of general population do have chronic headaches. But in a headache clinic, we see a lot of them, because a lot of, 70 to 80% of patients who come to a headache clinic do have chronic headaches. And 14% of episodic headaches convert to chronic headaches sometime in the lifetime. And this certainly leads to increased disability, impaired quality of life, and higher healthcare utilization costs. And so this was a study looking at, how does cognitive behavioral therapy, not medications, how does that help both insomnia and to reduce chronic migraine? So this was two studies, they were looking at, behaviors, how can you modify your behaviors so that you can sleep better? So the first study was, the first study was by Dr. Calhoun, and she did like a 1.5 hour intervention. And the second one was by Dr. Smitherman. He did 3 30-minute sessions. And this was what they said. As I said, they tried to modify their behaviors, which is, try to eliminate naps, move dinner greater than 4 hours before bedtime, and limit fluids within 2 hours of bedtime, eliminate TV, reading, eliminate TV and reading and music in bed. You can have it outside, but not in bed. schedule consistent bedtime that allows 8 hours in bed. So get that 8 hours. And then you use visualization imagery techniques. These are relaxation techniques, when you're in bed. So that was by Dr. Calhoun. And then Dr. Smitherman, he did 3 sessions, and this was what he recommended. He asked them to go to bed only when sleepy and intending to sleep, leave the bedroom if unable to sleep after 20 minutes, and return only when sleepy, use bedroom only for sleep, set an alarm and get up at the same time each day, and sleep restriction, which means, I think all of us have the tendency, if you feel that you're not sleeping, I sleep only for 4 hours, so I may have to be in bed more so I can sleep more. That does not help. That really does the opposite. So that's something to keep in mind. So sleep restriction is something that we advocate if you have trouble with sleep. And controls where, they did not have any of these. They said, well, consistent dinner time each evening, acupressure twice a day, consistent liquid intake, 5 minutes stretching, and serving of protein. So that has nothing to do with sleep in general, but good habits in general, okay? And what they found was, so Dr. Calhoun's study, they looked at the controls both of them did have headaches, all of them had headaches, and the controls have 24.9 headache days a month. And these are people who we're talking about chronic headaches, significant frequent headaches. And active treatment, treatment group had about 25.9 headache days. And in follow-up, so it was like a 6 weeks follow-up, the control, who did not have that cognitive behavioral session, continued to have those headaches, but the active group who went through that session had about 18 days of headache days a month. Still high, but much different than from before this. And Smitherman, similarly, he had controls 20 days, headache days a month. Active treatment group had 22 headache days a month. And follow-up, control group also had less headaches, but active treatment group had significantly less. So this goes along with the relaxation and the stress reduction and all the good habits that we need to help with insomnia also does help headaches. And that goes along with what Dr. Wells had talked us to before. So switching to cluster headaches, that's another headache which really has intertwined with sleep. And cluster headaches are really, really severe headaches. They are more one-sided. They can be behind the eyes, really piercing, throbbing pain associated with, redness in the eyes, tearing, nasal congestion, drainage. You can have like closure of one eye, little droopiness of the eye. And they can happen anywhere from 8 per day to 1 every other day. So they vary in frequency. And they're excruciating headaches. And those have a predilection. Most common time to happen, this is the time during cluster headaches. It can happen anytime during the day because I said it can happen 8 times a day. But it's more commonly, they wake them up in the morning, like around 2 to 3 o'clock in the morning. They wake up with this excruciating severe headache. And unlike migraine, they cannot just sleep. They have to just get up and pace around because that's the worst thing. They can't just go back to sleep. And another kind of headache, which is association with sleep, is something called hypnic headaches, which is it's just not very common, but can happen. They're called alarm clock headaches because for the regularity that happens at particular time of night, they can develop only during sleep and causes you to get up from sleep. Occurs about greater than 10 days a month for more than 3 months to be called the hypnic headache. And they can last anywhere from 15 minutes to 4 hours, average duration of about, as I said, 160 minutes. Happens more in the older age group, unlike migraineurs and kind of thing, like 61 years is the average age. It can be both on both sides or on one side and can happen like about 2 to 3 weeks a month. So that's something which is a headache, which has very close association with sleep. And then there's something called exploding head syndrome, which is again very rare. The reason why I would like to bring it is it's something which just happens in sleep. There is no pain, but then you wake up with this really loud sound, like a banging sound. And mostly it happens during sleep-wake transitions. And you can wake up with fear, anxiety, like your heartbeat is, heart is beating fast, and usually no pain or headache, but you can be very scared because you feel like something has gone really wrong in my brain. But usually there's no treatment. It just takes care of its own, but something happens in relation to headache. Now, I want to say something about sleep apnea headaches, and sleep apnea headaches, like basically they happen when you are having sleep apnea, and when you're treated for sleep apnea, that goes away. And what do I mean by sleep apnea? Is basically, you have some obstruction in your pathway, in your airway when you're sleeping, and that obstruction either causes you to stop breathing for at least 10 seconds or longer, or your breathing is shallow, that you either drop your oxygen levels or you wake up knowingly or unknowingly. Okay, so that's what sleep apnea means. And I'm going to show you just, again, this is, like what I would like to show you is, what happens when you're having an obstruction of your airway. This is someone, one of our patients in a sleep lab who's having a severe degree of sleep apnea. So this is how your breathing should be. Don't forget about everything else. This is how your breathing should be. See how normally it is. And see what this patient is having is, he's not breathing at all here. Then he wakes, he has a few breaths here, then goes without breathing. Then he has a few breaths here, goes without breathing. But more importantly, look at your the oxygen level. Your oxygen level should be, certainly a normal individual should have oxygen level like 93 and higher. And usually your oxygen level should not fall below 90. Okay. But look at this individual is a normal individual otherwise, but he's having sleep apnea at night. And so what is happening is, he's dropping his oxygen level from 92 to 87, comes back up, and then dropping again to 84 to 76 here, comes back up. And sleep apnea is worse during a kind of sleep called the dream sleep or REM sleep. And that's when sleep apnea is worse. So this is not during dream sleep. So see what happens when he's going into dream sleep. This is what happens. He's having longer periods of not breathing. These are longer periods of not breathing. And look at the oxygen levels. These are some individuals, if you're like in the hospital and the oxygen levels are monitored, and everybody will come in rushing to see what's happening, because that's not safe. And I'm not saying everyone who has sleep apnea has this significant drop, but if you have a severe degree of sleep apnea, this is what something happens at night. And certainly that is not really going to be good either for your arteries, for your brain. And what happens with oxygen level dropping is your carbon dioxide builds up, and that's what causes the headaches when you wake up in the morning. So that's what causes sleep apnea headaches. You wake up with this really dull, achy headache in the morning, which usually goes away after a few hours. But then, it's not the headaches, it causes other things too. Okay. So again, a relationship between sleep and headache, hypnic headaches and cluster headaches, they awaken the patient during night, as we saw. Migraine and tension headaches can start at night, but you can wake up in the morning with headache. You don't necessarily have to, you wake up in the morning and then you feel that you have a headache, or it can wake up at night. You can wake you up at night too. And sleep apnea headache, as I said, morning headache that happens due to sleep apnea. So again, as you see, there is a very close association between headache and sleep. It is in both ways. Sleep can cause headache, sleep disturbance cause headache can cause sleep. And prevalence of both of them, sleep disorders and headache, are common. And sleep disorders are greater in the headache population than otherwise. As I showed you, both share a common pathology. And we do this in our headache clinics. Screening for sleep disorders need to be part of a headache evaluation by all providers who see headaches. And as patients, what we could do is, like we could ask our providers, or like if you have any symptoms or any symptoms of sleep apnea or other things, you can discuss with them. And sleep hygiene and basic sleep management strategies should be followed. And there's clearly opportunity for a therapeutic and non-therapeutic, non-pharmacological options. So how can you improve your sleep? So this is what we call a sleep hygiene. Always have a regular bedtime and wake up time. Don't try not to sleeping in on weekends. That would be helpful. And use your bedroom only for sleep. Don't take your homework to your bedroom. Don't take your work to your bedroom. Don't take your laptop to your bedroom. Have the TV out of your bedroom, in the living room. Okay. And it's a good practice, and it's a good sleep hygiene to at least close off all our TV, all our gadgets, electronic gadgets, at least an hour before bedtime, and do something relaxing like listening to light music or reading a book. Don't don't get into an excited book and start reading and then get engrossed in that, but something, that could be light. If no sleep for about 20 minutes, you just don't lay there. Get out of the bedroom, do something relaxing, again, like listening to music or something like that. Don't switch the TV on. Try avoiding naps during the daytime. And if you have to, it should be a very short nap, like about 20 minutes or so, 20, 30 minutes or so, and avoid certainly after like about 2 or 3 o'clock. And the other thing is clock watching, that is something, patients who do have difficulty falling asleep, that could be a very, a stimulant, oh my God, it's 2 o'clock, I'm still not sleeping, I have this and this to do, I'm not going to be able to function during the daytime, and that only stimulates you, that doesn't help you in any way. So don't keep the clock, turn the clock around. If you want to keep an alarm, set the alarm, that's okay, but don't look at the clock. And as I said earlier, no caffeine after 2 or 3 o'clock. That's important for headache and sleep in general, because, and as I said, I have plenty of my patients who come and tell me, I can drink coffee and go to sleep, but no, it ranges the quality of sleep. And a lot of these soft drinks have caffeine in it. Unfortunately, some of us don't realize that, drinks like, Mountain Dew and those orange colored drinks all have caffeine in it, and it's good to avoid them. No alcohol within 6 hours of sleep, because, alcohol can make you sleep, but once the alcohol is out of your system, your quality of sleep is really deranged. And then try to practice some really nice rituals that help you relax, like a warm bath, reading, so that would be a ritual before you go to sleep. And avoid exercise close to bedtime, because you really need some time to wind down and calm down and all that. So that's what I have. If you have any questions, I think that's what I have for today.
Thank you so much. That was wonderful. I know I definitely need to work on my sleep habits. That is for sure. So now we are at our break time. We have a 10-minute break. So can we convene at 12:45? So it's about a minute less than 9 minutes. What I want to remind everybody is we are offering 4 Amazon gift cards. So we have picked 2 people that are given the gift cards that were in this session. 2 people will be given gift cards in the second session. You will receive a message from Helen, who I introduced earlier. And do not forget that we have 2 wonderful patient advocates that will be up this afternoon, as well as the panel of doctors will be back, including our patient advocates and Helen this afternoon. Right after our break, and this session will end and you have your email with the link for the second session. So we will see you in about 9 minutes. Grab a drink and we'll see you soon. Thank you.